Welcome to the Crozier Family Medicine Residency Program. My name is Bill Warning and I'm the Program Director. Our Center for Family Health in Springfield is Crozier's largest outpatient office. We are proud to be the first residency program in the country to become certified as a patient-centered medical home, and we take care of a broad range of patients regardless of their ability to pay. As Crozier's largest clinical office, we have 16 exam rooms, a procedure room, and an OMM room to care for our patients. We also have an on-site clinical psychologist with his team of behavioralists, and we have a fully functioning lab where we can do in-office procedures as well as anything that we can send out as well. We draw all our own blood here, and we also perform many procedures. When our residents have an office session, they're assigned 2 exam rooms each, in addition to their team members. Each resident is assigned to a medical assistant, usually has a medical student working with them, and our preceptor room and our resident room is an open structure where residents can do huddles with their team, prepare for the session for the day, and really work with closing the quality care gaps for each patient encounter. In addition to our open space resident room, we have our preceptor room attached right in the back where we can actually work with the residents closely in their patient encounters and talk confidentially about each care. The preceptor room also has the cameras that we can see each resident encounter as they see patients in our 16 exam rooms. We ensure that we have the educational support of our residents. We always have 2 preceptors in the room, and we do a 1-to-3 ratio where each preceptor is not responsible for more than 3 residents at a time. Ensuring that we have 2 faculty available during each session, faculty are freed up to do procedures at the time of the visit or go into a deeper dive of care for the patient. Here, you'll be trained in team-based care. All of our residents work in teams with a medical assistant and usually a medical student as part of their team. Our residents are trained to use behavioral science, social workers, and our nurse case manager as well for the care of their patients. We don't have a nurses station. We actually do a team-based room where all the nurses and the residents work side by side in the care of the patients. Each resident is assigned to 1 medical assistant who works in their team, so they work side by side for the care of the patients on their schedule that session. They often have a medical student working with them who also works on the team and has a specific role in the team-based care.
So before each clinical session, we have a huddle sheet that we go over with our MAs, where we discuss the preventative care indicated and due for the patient. So that can be diabetic eye exam, pap smears, colonoscopies, fit tests, as well as routine labs like A1Cs or urine testing. And the benefit of doing that beforehand is that the patient can be sure that they can walk out of here with the referrals or the orders that they need to get their preventative care.
Perfect.
Each of our exam rooms is equipped with sound and video in 16 exam rooms, so our residents can be directly observed while they're in the room with the patient, and we actually do formal recording of each resident twice a year, where the resident can actually see themselves on videotape and review it with our behavioral health specialists as well as our faculty. This is a great evaluation tool for our residents. We don't have to be in the room to directly observe them, and they can actually ask us to watch certain encounters that they deal with adolescents or moms or children, and we can actually help them from a distance. We have a fully functional procedure room that can be used by the residents and faculty anytime during their continuity clinics. We also have several specialty clinics. A dermatologist will come in twice a month and do full dermatologic procedures in this office, including procedures that we normally don't do in an office setting under the supervision of a dermatologist. We have a sports medicine clinic, so we do a wide variety of joint injections, musculoskeletal examinations as well, and we do them right here in the office. We have a GYN clinic, including colposcopy, IUDs, and Nexplanons, and all residents are trained to perform these procedures. As I say, our procedures have gone up in this residency program over the years, and we pride ourselves in training physicians who will go out and perform basic and some advanced family medicine procedures in the future. We have an OMM room where we can do osteopathic manipulation therapy on our patients right here. We do didactics once a month in this room, as well as we have an OMM clinic in the evening where residents can bring patients in and actually perform their OMM skills. Our clinic is supervised by an advanced trained faculty member who has OMM fellowship experience. We have a very strong didactic curriculum here at the program. Every Wednesday morning, we close both offices and all residents are required to be here at their conference lectures. We have lectures from outside speakers, from our faculty, and our residents also give presentations. We also have Tuesday morning report, which is mostly focused on our inpatient service, where we do that at the hospital and go over cases of inpatient medicine as well as specialty lectures as well. Our residents who have an interest in teaching and faculty development can also lead student groups. We have medical student groups here every Friday afternoon where all the medical students will come together and be taught by a curricular topic by one of the residents.